Hi, Dr. Daniel Hoover here with SOHMA Integrative Medicine, here to talk to you about spinal decompression. A question we get often is spinal decompression good for your spine? There's a couple of ways I want to answer it. The first is, I would say most of the time it's bad when you don't get spinal decompression. Because what happens is, with gravity, our spines are compressing all day long. Have you ever noticed you get in the car and you adjust the rear view mirror, and then at the end of the day, you get back in the car and you have to readjust it again? Why is that? Literally, the discs between our vertebrae get compressed throughout the day, and they don't have an opportunity to rehydrate because the fluid comes out of the disc, and we just literally get shorter throughout the day. It's a must that we decompress. But the question is how, which is the appropriate method. You might hear about yoga being really good for decompressing the spine. You may have seen, and I agree to some degree, it is very helpful. There's a lot of inversion techniques. And that leads me to a lot of these types of equipment that are being sold for people to use at home. How can you decompress your spine at home, and is it safe? It depends. What I want to distinguish here, there's something called non-surgical spinal decompression that's clinical, that we do here at SOHMA Integrative Medicine, that has a 70 to 90% success rate, meaning those that get it never need back surgery. It's very specific for the neck, for the low back, and we can target L5, L4, L5, S1, and we can program it to pull 65 pounds of pressure, 35 pounds, 70 pounds to 40, and be very specific. Now that's corrective spinal decompression. We don't want to collapse that or confuse that with inversion or gently decompressing the spine. So what I want you to get, I'm a big fan of the inversion tables. I think they're misused and misunderstood. When a patient completes non-surgical spinal decompression, I encourage you to do something like inversion. The thing with inversion and at-home techniques, it's more of a maintenance thing. It's not going to target the exact vertebrae that you want. It spreads it out throughout the spine. If I go upside down, it can decompress here, or just sort of throughout the spine. I want to target the exact area to pull in that disc bulge so I don't need surgery. Take the pressure off the nerve, move on. Oh, and that reminds me, last thing. What's one of the side effects with spinal decompression? Being taller. So that's it on spinal decompression today. I'm Dr. Daniel Hoover with SOHMA Integrative Medicine. You want to learn new techniques, more techniques on how to stay healthy, get out of pain, into balance, and back to play? Hit the subscribe button here, or follow us on social media.